In 1998, SSDP was founded in response to the Higher Education Act, which stated that students could lose their federal financial aid if convicted of a nonviolent drug offense. Our very first motto was schools, not prisons, because we believe that when a young person is struggling with problematic drug use, the worst thing that you can do is take them out of school and cut them off of meaningful social support. Traditionally and currently, SSDP has been primarily known for marijuana policy reform, as it is one of the most destructive drug policies. And while marijuana policy reform seems inevitable today, we still have a ways to go when it comes to sensible drug policy, because the United States is still 5% of the world's population and 25% of the world's prison population, with over 50% of those for nonviolent drug offenses. We still have a ways to go when it comes to sensible drug policy, because we still treat addiction as a criminal justice issue rather than a public health issue. Like other social justice movements, the drug policy reform movement has undergone several iterations throughout history, with each transformation adding nuance to past movements while expanding the definition of progress for the future. The harm reduction movement began in the 1980s as a public health response to the spread of HIV and hepatitis C amongst injection drug users. And today, harm reduction is its own self-encompassing philosophy as an alternative approach to drug problems. In the 1990s, academics in the field of drug policy reform stood behind the argument prohibition simply doesn't work, and found unity around issues of racial justice, mass incarceration, and global human rights. At Students for Sensible Drug Policy, the work that we do commemorates, unites, and builds upon the drug policy reform movement as a whole in order to create a more holistic vision of a post-prohibition world. Resting on the foundations of drug policy reform movements of the past, SSDP is truly a unique space that seeks to meld all slices of the pie of drug policy reform. In accordance with true SSDP tradition, our 5 speakers took this theme in vastly different directions in a way that only SSDPers can. And we couldn't be more excited about this. We hope that these speeches inspire you. We hope that they educate you and make you reflect on what it means to be a student for sensible drug policy, why you joined, and why you're still here today. And now I'd like to turn it over to Molly Davis from Rocky Mountain College to present Addiction is a Health Issue.
America, the greatest country on earth? America, where we have the highest incarceration rate in the world. America, where freedom reigns. America, home to 1/4 of the world's prisoners. America, home of the brave. America, where we treat drug addiction as an issue of incarceration rather than a medical problem of health and well-being. This is a pattern that even President Barack Obama addressed, saying, over the last few decades, we've locked up more and more non-violent drug offenders than ever before, for longer than ever before. This includes drug addicts. Drug addiction is an issue not properly being addressed or helped in the United States of America. Why? Well, because we treat addicts as criminals and not as patients. We live in a nation where a majority of those addicted to drugs are only legitimized and can only get help if they have millions of dollars or if they have celebrity status. Otherwise, they must hide in constant fear of getting thrown in jail rather than getting help that they need. I would like to clarify something with you today, and that is, addiction is a health issue, not a crime. We need to treat it as such. We cannot treat the problem of addiction with incarceration, because incarceration isn't a treatment, it's a punishment. It shouldn't be treated as a crime because the most recent data reveals that inmates who are serving time on drug-related charges have the highest recidivism rates compared to any other prisoner. This is due to a few reasons. One, they aren't given proper tools to work with in jails and prisons. And two, once out on the street again, they return to old circumstances and behaviors. The cost of incarcerating addicts is 10 times more than treatment costs, according to CRC Health. This data shows that incarceration is not helping the root of addiction, while also offering an alternative of healthcare that could ultimately cost less and be more effective. When we treat it as an illness or as a health issue, we see only positive results. For example, we see this in Portugal when they took a step in the right direction. Portugal decriminalized low-level possession of all illicit drugs in 2001. This is a step in the right direction, and one of the most extensive drug laws that we've seen in the world thus far. 100% of the money used for prior criminalization was reallocated towards health programs, such as counseling, treatment, and clean needle exchanges. The results of the Portuguese experience demonstrate that drug decriminalization, alongside a serious investment in health and treatment services, can significantly improve public safety and health for the individual. This results in more access to drug treatment, a decline in drug-induced deaths, and a decline in sexually transmitted disease, which are astounding results on any level. So this is how one country changed their policy, and I'm sure you all knew about it before. And I'm often asked, okay, that's a great example, but can it be done in the United States? And my answer is yes. We actually have seen a step in the right direction. In Gloucester, Massachusetts, a police department is offering an addict amnesty program. Last May, the police chief, Leonardo Campanello, announced that opiate addicts who come into the station for help won't be charged with a crime, but instead, they'll be given help, even if they have drugs with them at the time when they come in. They'll be given health resources, such as access to counselors, rehabilitation, and therapy. He says, "We're open 24 hours a day, 7 days a week, to help you when you want it. There is recovery and a new life that can and should be yours." So even if this policy only helps one life, only helps one person, that's still a human life, and every human life is valuable, regardless of celebrity status, regardless of money. This is a spectacular example of how much of an impact one person can make in addicts' lives by one change of policy. Portugal and Gloucester know addiction is a health issue, and they treat it as such. It is possible to reform our policies to ensure health is our top priority when dealing with drug addiction. America, home of the free, home of the brave, not unless we start changing. Because we live in this nation, we as citizens can make this positive change occur. So I encourage you all to consider drug addiction, not as a crime, but as a health issue, and ask yourself how you can help change the status quo. If you really believe the United States of America is this great place to live, then what can we do to make this culture, to make this society a better place for citizens to get the proper help they need as individuals? Thank you.